Hello, everyone. Welcome back to another recap episode of PT Meal Podcast. Today, we're going to hear again highlights from our recent guests. This is just the first part of the batch of conversations I had for this season. If you haven't subscribed to the podcast, please do so in Spotify, Apple Podcasts, Anchor, YouTube, or whatever podcast apps you're listening to. Also, please do follow us in social media in Facebook, Instagram, Twitter, and LinkedIn, PT Meal Podcast. So, all right, for this episode, you'll hear Michael Datu describe what a skilled nursing facility is and what he likes about working in one. Barbara Parks talked about equine physical therapy, specifically assessing horses and how to make horses do what you want them to do. Jean Pangilinan, an officer of the Association of Philippine Physical Therapy Students, shared her initial reactions regarding the lockdown and how it would affect her schooling. Juntilla discussed why manual physical therapy is demonized, abused, and misused. And lastly, Charmain Geronimo described the Filipino Physio platform and how it can help level up Filipino PTs practices. So, let's take a listen. How would you describe a skilled nursing facility? What is a skilled nursing facility for those who are not familiar on what it is?
Okay. The best way to differentiate it is
Mm-hmm.
to see the difference between a skilled nursing facility as well as a nursing facility.
Mm-hmm.
So at a nursing facility, it's mainly nurses and the patients,
Mm-hmm.
whereas skilled nursing facility is more of a rehab institution or facility,
Mm-hmm.
and um, there's rehab in it.
Mm-hmm.
That's why it's skilled. If there is no rehab in it, it wouldn't be considered a skilled nursing facility.
Mm-hmm.
So the main thing is in a skilled nursing facilities, things will not happen if nursing's not there. Things will not happen if rehab's not there. Things will not happen if respiratory therapists aren't there. It's a combined factor of all of these disciplines as well as departments. Activities personnel have a huge portion because they if a patient we send patients to them if they're at high risk for falls.
Mm-hmm.
So again, this is us. If you are a team-based person and you kind of like more acute things or more subacute
Mm-hmm.
factors of physical therapy, SNF is definitely the place for you.
Mm-hmm. These any the patients that you have are patients coming from the hospital, right?
That is absolutely correct.
Mm-hmm.
Yes, when they're more stable.
Mm-hmm. Okay. So, can you describe to us like what a typical day of a physical therapist is in a skilled nursing facility?
Okay, what I love about skilled nursing facility is that you just kind of clock in your 8 hours.
Uh-huh.
So I could come in as early as about 7,
Mm-hmm.
and then I could come in as late as maybe 11 or lunchtime if I wanted to.
Oh, okay.
Yeah. Yeah. So I
That's
clock in
nice.
8 hours. Yeah. So
Uh-huh.
it's very flexible. So as soon as I go in, I put obviously my stuff down. I look at my schedule, I print it out. I see who is scheduled for treatment and the co-treatments. I check who the OTs are because again, skilled nursing facility is based on teams.
Mm-hmm.
Um, I I, as well as the OT, need each other's discipline in
Mm-hmm.
order to perhaps sit a patient or do something functional. Where if we separated, perhaps the only thing we could have done might have been range of motion,
Mm-hmm.
which isn't the best for the patient.
Right.
And then after that, I would definitely talk to um, uh, each. So our total team is about 24, 22, and then we have sub teams.
Mm-hmm.
So I love the team that I'm part of.
Mm-hmm.
Luis and Taylor are amazing PTAs. I requested them for that very reason because they're amazing. And then we always have the best communication. We talk about a patient, and the thing I love about SNFs is that these are patients that again might have fractures or orthopedic conditions where maybe the hospital didn't catch.
Mm-hmm.
Or perhaps on the way to subacute, something might have happened.
Mm-hmm.
And that's where I think the knowledge of PT comes into play. I think again, there have been instances where we go in, we suspect a dislocation of the shoulder, maybe anterior dislocation, and then we request an X-ray. And once it's done, perhaps it does show that anterior dislocation. So that's one thing I love about PT. And a lot of times in our facility, a lot of times PTs will be called into, hey, can you check this patient to see if you suspect that they have any broken bone? So maybe we could refer to ortho, refer to maybe a radiologic procedure or anything like that. And then the main day, again, is just treating the patients, going back and doing daily documentation. Each treatment there is definitely much more than your outpatient. Maybe I usually see maybe about 6 to 8 patients a day. And each patient might be about 45 to an hour. And then the remainder of the time, I'm working with nursing, I'm working with maybe activities personnel, I'm talking to family members. It's definitely a holistic approach.
Right.
Overall care.
How do you make horses do what you want them to do if you can't instruct them? How creative would you be?
Yeah, so that's again where having some background like horse knowledge is pretty important. You know, having a general understanding of training and how to motivate a horse to do something is important. But think about like I kind of relate it to pediatrics a lot. So sometimes you might have a kid who is nonverbal, they can't communicate easily with you, and you can't communicate easily with them. And so you have to find a creative way to get them motivated and to accomplish the task. So it's very similar, I think, with horses, because we don't speak the same language, but we can kind of find a way to communicate that's creative and, you know, using things that you know are motivating to a horse, like food. Food's always motivating to a horse. So you can use things like that to kind of get them to cooperate. And horses are really generally very cooperative and want to please. So if you're patient with them and have kind of the training skill set, at least a little bit there, you can usually figure a way for most things. Now, there are times that I have to say, oh, that didn't work like I thought it was. Let's try something different, of course. But yeah, it's I think it's pretty similar to working with kids a lot of the time.
Is it the same like with treating humans that you have to build rapport with a horse before,
for sure.
you know? Oh, okay.
Yeah. There's definitely a layer of trust involved, right, in everything. And some horses more so than others, right? They all have different histories. Some of them may have come from a really, you know, traumatic background of something, you know, an accident that was traumatic or an abuse case or something, you know, really awful. Or they may have had a really, you know, easy life where they had one loving owner for all their life and it's been pretty smooth. So those two horses would take, you know, a different amount of warming up time to trust me coming in. But similar to people, right? We all have kind of different backgrounds, and some patients warm right up to you and some you really have to chip away at and convince them slowly over time that, you know, we really do have your best interest at heart. We're here to help. So yeah, moral of the story is it's really similar.
Is it
really
true that horses would feel if you're afraid of them?
Oh, for sure.
Oh, really?
Yeah.
Let's look back and reflect on the past years, academic year, when COVID was announced. It was yung lockdown. It was 2020, March, I think, almost at the end of the second semester. Tama ba? So, initial reactions when you found out that that last part of the semester is going to be held online, or biglang in-announce, oh, wala na tayong classes, ano na mangyayari. So, initial reactions, ano yung mga naisip nyo, ano pumasok sa utak nyo that time? Let's start with Jean.
Actually po, nung nag-announce na parang magkakaroon nga po ng lockdown, ang sinabi lang po kasi talaga sa akin, sa Fatima po kasi parang may 1 week po talaga kami vacation. No week na rin po na yun. Okay. Dahil ang sabi po sa amin is sa-sanitize daw po ng buong university. So akala ko parang, okay, 1 week lang yan, babalik din kami ng school after the following week, ganyan. So, for me, ginawa ko siyang pahinga. Parang sabi ko, it's time for me to rest naman muna for that week before man lang parang bumalik ulit ng school. Pero nung nagtuloy-tuloy na yung lockdown, parang sabi ko, oh my gosh, paano yung school? Lalo na parang I was in second year that time. So lahat ng mga assessment and treatment subjects, pinapag-aralan po namin that time. And alam ko po na pagdating na third year, it was like more on integration of knowledge. So lahat na ng pinag-aralan namin sa first year to second year, doon na namin medyo i-apply or doon na namin siya pagsasama-samahin. So, medyo kinabahan kasi sabi ko, sapat na ba yung pinag-aralan namin? Sapat na ba yung mga naturo sa aming demonstration for assessment and treatment? Ganyan. Then, nung katapusan po kasi na second sem, pinagawa na lang po kami ng mga report videos para yun na po yung final output namin tsaka final exam po namin for the rest of the subjects. Then, ang batch po kasi namin yung new curriculum, tri-sem po kami. So, dire-diretso po yung klase namin. So, wala po kami summer break. If meron na po parang 1 month or 2 weeks lang. So, dapat po by April or May, nasa-start na po ulit kami mag-klase for the summer. Then, hanggang sa parang nagtuloy-tuloy nga po yung lockdown and then wala pong balita if paano po yung pasukan, if maghihintay po bang matapos yung COVID or what. Kasi yun nga po, pumasok na po yung online classes. At first, medyo nahirapan po kami. Buti na lang po, nung summer po is 2 lang po yung subject namin and hindi naman po siya masyadong mahirap for our part po. Parang lang po, ethics and PTP, management, mga administration, PTAT, ganun po.
So kayang-kayang i-online?
Yes po, kayang-kaya i-online, more on mga parang paperworks, mga pinapagawa ng presentations, ganyan. Pero nung nag-start na po yung first sem, doon na po kami parang, oh my gosh, ito na talaga to. So parang kailangan may patient ka, mag-demo ka, tapos mahirap din po since dati nung nasa regular schooling, syempre yung mga patient mo, yung mga pinagdedemohan mo, pinagdedemonstrate mo is mga kaklase mo din. So, alam nila i-react kapag kunwari diniti-R mo sila or may hinawakan kang part ng katawan nila, alam nila i-react. Pero since bawal pong lumabas, then by that time, parang hindi pa pwede lumabas kahit parang 19 or 21 na po yata yung pwede lumabas na yung ECQ, 21 years old and up, and hindi pa po ako 21. So, parang kailangan ko manghatak ng mga kamag-anak pa dito. Para sabihin ko, okay, mga ganito gagawin mo, okay, ganito gagawin mo. I-discuss ko talaga sa kanila kasi ganito yan, ganyan. Parang, hindi ko alam kung teacher ako or PT kasi talagang gusto ko kasi parang na-experience ko pa din yung parang dapat PT ako. Sabi ko, ganun din naman yun kasi kapag nag-PT ka, tuturuan mo din, hindi din naman sila physical therapist na tulad mo. So parang na-experience ko na rin kahit paano, parang internship na settings.
How would you say that, manual therapy is demonized or not, or how is it abused or misused?
Yeah, so for some individuals who may not be, acquainted to or thorough on how OMPT is being applied, demonizing here means portraying a specific or something to be wicked or something threatening or something that is worthy of contempt or something of blame. And I was looking at this earlier. It's something that you demean, it's something that you slander, or something that you discredit, because overall we don't really understand how is it done. So OMPT has been one of the association that has a subgroup of the World Health Organization, also under the physiotherapy or the World Confederation of Physiotherapy or Physical Therapy, which is the IFOMT. the International Federation of Orthopedic Manipulative Physical Therapy. This is the international federation of OMPT bodies around the world that has a training that of the same standards. And hence there is AYUMT in the US, we are fellows with. So IFOMT, we know for those who have been trained under a specific training, let's say a fellowship program in manual therapy, like what I was doing and some other colleagues. In UK, they have master's level. In Canada, in Australia, OMPT is always defined as a specialized area in PT that that manages neuromusculoskeletal condition based on clinical reasoning, using highly specific techniques like manual therapy and therapeutic exercises, using evidence-based, including the whole psychosocial realm of the person. So that is the definition of OMPT, or manual therapy in particular, what the physical therapist should be doing as far as those like specializing the area.
So where do you think this hypercriticisms or this criticisms to manual therapy coming from? Is this coming from therapists that are not well versed with manual therapy, or is this coming from physical therapists who have studied under a certain school of thought of manual therapy that they think that it's not useful? So for in your view, where does this criticisms are coming from?
Honestly, I am not sure. I have my own like probably theories as well. But I know these physios, these PTs or critics to manual therapy, they're great practitioners, they're great clinicians. But we know the fact that each of us has its own specialization, Some are really, they don't like manual therapy because they work in acute, they just love acute care. Some just want to be in home health. They don't even know any like specific, they don't want to work on that part of orthopedic manual physical therapy, and the same as those who are devoted to the practice of manual therapy as well. So we have the passion of learning. As a matter of fact, we have continuing educations. We do go to academy national conferences yearly for new updates, and I think most of this are giving assumptions, and that's what the article. If you look at farther, there are 8 assumptions that Chad Cook has pointed out. That for those who are not keen into detail, sometimes we're just, or even like the public, they will say those assumptions are really easy to say, and then but if we debunk each one based on evidence, actually there is an evidence that we can find that it is not true.
Tell us more about the Filipino Physio platform.
So the Filipino Physio platform. So here we gather different mentors all over the world. So meron tayong mentors from UK, from Philippines, from the US, and meron din tayo from Doha. So ang target nito is to impart the learning that they have, working overseas or specializing into a certain topic. So more of Filipino officials sharing globally. Ang maganda din dito is parang lahat is excited to share. Kasi aminin natin, iba-iba yung practice per country. Pero yung thought about the evidences is same lang naman eh. Pare-parehas tayo nag-aaral about the evidence-based practice.
Right.
So kung ano yung i-share natin na na hindi natin makukuha sa parang from here meron tayong limitations, like here in the Philippines hindi pa ganun ka popular yung other practices such as women's health, pelvic health, rehab, and sa ibang bansa is meron ng existing na ganung practice. So maganda na parang i-share nila to our Filipino PTs. Para then we can actually use it to our patients as well, especially here in the Philippines.
Right. We're all practicing evidence-based, but the mentors are bringing in something special from their practice. Experiences nila, yung rich, experience and knowledge nila from their actual practice in their respective fields and settings. So let's dive in more on your mentors. Talk to us more about who your mentors are and then what are they bringing to the table.
Actually, as of now, di ba we have 12 master classes.
Mm-hmm.
So, yung mga mentors natin, we can actually have more mentors. Kasi ito yung mga more of, based on my research, ito yung mga mentors na nag-specialize into specialized topic. So, we will have, yun nga, si Erwin Valencia for sports and si Bernard then from Doha. So, Aspetar and NPA, di ba? PTs, and then they can teach us something about sports, which is really great. And then we also have Erson Religioso for the orthopedic master classes.
Yeah.
And we also have Ma'am Christine will also be teaching us about sports then and orthopedic master classes. And then we have Lily. She'll be teaching women's health and Patilin Fatima. And actually a lot of mentors like from the Academy of the Filipino American PTs, then may mga nakuha tayong mentors will be teaching about leadership. Kasi hindi lang tayo more of yung mga ibang topics. More din tayo about education, research, and leadership. They will be also teaching us this topic.
Right. I was looking at your website and seeing at the mentors, and most of them were already guests in this podcast. And kaya sabi ko, nakakatuwa. She brought a lot.
You can also be part if you want.
I would like to be part of that.
Kasi yun nga ang is to to share and alam talaga natin na kailangan talaga natin ng voice sa profession natin, especially here in the Philippines. And it's more of giving back. I think kaya yung mga mentors then is more of very participative because they want to give back to our here in the Philippines.
That's true. Nandun talaga yung spirit of giving back sa kanila for most of them that I have already talked to. Makikita mo talaga yung zeal and excitement nila to share what they know, to share to our colleagues what their practice, their experiences. So, nakakatuwa. So how do you think this new learning medium or platform could help our profession and our colleagues in I think to leveling up our practices?
Actually, I believe like in our profession, we need high quality education. And with high quality education, it gives us confidence to speak up and also to treat patients. Kasi if we have not good foundation about certain skill, hindi natin siya mag-vocalize, hindi natin siya, we're not confident about it. But if we have up, like if you listen to a lecture, if you practice it, if you get a certification from it, you will gain more confidence. And I think in profession natin is talking about skill. So that's why we need continuing education, especially the practice in healthcare. It's evolving. We really need to step up and be updated with our knowledge. And ang maganda dito is that I have yung sa summit, there are students also participating. Looking forward to certain topics. So I think by instilling that, early pa lang na, being updated, educating ourselves, maganda yung future ng profession natin.